across these disciplines and working with different colleagues from different fields, so nursing, pharmacy, doctors, all of that together.
Interprofessionalism means different areas of practice collaborating together for common goals. So that can include providers from different specialties, including nurse practitioners, nurses, social workers, pharmacists, all groups of people working together to a common goal with different backgrounds.
So for our work that we do in complex care, it's really important to have a team. Everybody has their defined roles, but within those roles, you have to sort of be fluid and be willing to do something that's not necessarily in your job description. So I might be sending a lot of faxes today, which would normally be sort of our program coordinator's job, but that's just to get the job done. A lot of times you have to really kind of do things that make sense for the work that you're doing right then.
I think a good interprofessional team is really collaboration and communication. So I think that it's really important that each individual is an expert in their field, as well as willing to learn from other professions. If you're not willing to learn from each other, you're not going to be able to successfully create a joint plan of care for patients. I think it's really important, like here at the clinic where we do complex case, where we can advocate for each role in the patient's plan of care. So like as a social worker, I can advocate for what I feel like is most important, and as pharmacy does that as well, then we can determine which need to be priority for that particular patient. Just like in any other clinic, it's really important to base an interprofessional team on the patient's needs, because every patient's going to be different and is going to need something different, and every clinic is going to need a different approach for the patients. So like here, we would need, with working with homeless or low income, it's more likely to need more intense social work presence. Whereas like at a hip replacement clinic, you might need a more intense physical therapy presence. I think that's really important in interprofessional, is making sure that the team meets the holistic needs of patients and not just what the provider expects that they need.
The best is a combination of good people. And finding the right people is really the hardest part, because you can go in with a plan of how to design a team, who you want the members to be, what their education and background training is, but if they're not invested in being a part of the team and they don't understand the value of the relationships, it's not going to work.
I think, at least for me, one of the biggest challenges is getting a good grasp of the roles that other professions and team members play inside that team. And so each team member has to have a good understanding of how each team member can effectively play a role for an individual patient's care, and so that way you can help each other most appropriately take care of the patient, which is difficult since we've all been trained to do different things and we've been trained in different ways. So, obviously there's a lot of conversation that has to go on about that. So
one of the biggest challenges with interprofessionalism, I think, is respecting each other's field and what you're doing. And I also think that's also one of the biggest tips that I can give you guys, is to make interprofessionalism work. You have to respect everyone's different discipline, and that you're all on the same team at the end of the day. You're all trying to work towards the same goal. Sometimes you'll find that one area will blame another if something goes wrong, and that doesn't really help anyone. It just causes turmoil. So if I could give you guys some advice, is learn to work with your colleagues, learn to understand at best what they do, and learn to know that everyone is working towards the same goal and is on the same team.
Well, there are many challenges. So there are structural challenges, meaning our basic workflow, I think, needs to be rethought. Our clinics aren't set up for huddles or more effective communication between lots of different people. We're still a very fragmented healthcare system. In fact, the bringing together of someone's health history really still relies on that individual person. There's no thumb drive that a patient brings to every different health practitioner inside and outside the clinic to help people say, oh, what did the pharmacist investigate, or what did the physical therapist investigate, and how can I bring that back to my primary care physician or my nurse practitioner to help them understand questions they may not have asked. So that purely structural model piece is a big challenge, and I think I would encourage anyone who are new to their professions to start to challenge the models that they see and think of their career as being, or part of their careers as thinking about innovative models of care, because we're going to have to continue to improve all the time. And then I think the other big challenge is that psychologically, and the way that professionals are trained, not only the way they build their identity, but also the basic building blocks of how they ask questions, are still very misunderstood often from different points of view. So in other words, you guys are getting trained as nurses and nurse practitioners, and you are being trained in the cultural mores and the rituals and the thought process and the way of thinking about a particular clinical problem in a particular way. And it becomes the water you swim in. Like, you don't understand that your water is actually different than the water in the next fish tank, right? And so I think human beings have a really hard time stopping and saying, okay, well, we think this way, and we're going to be now working with a new team member who is, let's say, a physician, and they think this way because this is the way they've been trained. So one of the biggest challenges then on that note is this individual ability to be transparent and to explain how you're thinking about something. And it's just as important as someone being open to listening about how someone thinks about something differently. And so that's, I think, one thing that we don't talk a lot about is what are the essential questions that as a nurse you are trying to answer about a profession, or about a patient, excuse me. And how is that different from an essential question that someone trained as a social worker or as a child life specialist or as a physician or as a pharmacist or as a physical therapist? Everyone is sort of coming to the case, which is the patient, with different questions that they're asking. But we're often assuming that others are trying to ask things that they might not be.
I think besides the skill to contribute to the team, you have to be a good communicator. You have to be able to talk in ways that patients, professionals, peers all understand. You have to make sure that you know how the other people on the team are thinking, not just how you think. Because if you can't adopt and understand what the other members of the team are saying, your contributions are going to seem one-sided and unhelpful at times.
I try to model accepting interprofessional collaborations in my clinic, in our space location. We have social workers and nutritionists and pharmacists here, and so we try to lead by example, and hopefully the students who work here can see that we value professional opinions from everyone, and we treat members of each team equally and try to get as much input from people as we can in order to get the common goal of the benefit of the patient.
Tricks. First, I would say return to being a human being, meaning nobody likes to be told what to do or what assumptions you have towards everyone. I think most people have had some experience where someone has assumed something about you, and it doesn't feel too good. So, but I think then also it's stopping yourself when you don't know how another profession thinks or how they're working, and to say, oh, wait a second, I don't know how a podiatrist is trained. I don't know. I know that they serve in diabetes clinics, but and I'm just about ready to work with a diabetic patient, but I really have no idea. And so to almost challenge your own lifelong learning to say, okay, it's up to me to actually figure this out. And of course, we've got the beauty of the internet at our fingertips, so you can do searches on anything all the time. But to just stop ourselves instead of jumping to stereotypes or jumping to assumptions, again, back to this human being assumption thing, to say, I'm going to investigate, and then I'm actually going to ask. I'm going to ask a question. I'm going to ask someone, hey, I'd really like to understand more about how you were trained and more about how you think about this patient, because I really want us to work together. And I think that, that means that you have to have a tone of voice that's open and respectful, that you have to acknowledge that human beings are separate personality-wise than professions, meaning you may meet one chiropractor in your life and that person might not be very nice. And so stopping yourself from generalizing to everybody. Or you might meet one, geriatric psychologist who happens to be the most awesome, wonderful person ever, but you never really learned how psychology is different than psychiatry in the geriatric population and where things might change. And so how can you're saying, oh, this person's wonderful, but you haven't really learned about how they are also valuing the patient and how their training is bringing other things and other ideas to the challenge at hand. And so I think it's us stopping and just acknowledging what we don't know and the people that we don't know, and then moving proactively forward to understand how those people add value to the team in a way that's respectful and in a way that is open for finding clues to some things that, you never know who's going to find the piece of the puzzle that's going to unlock this amazing insight into someone's life and how to help them better. You just don't know who might have that piece of the puzzle. And so I think those are some of the tips that I would give people as they, move forward and try to work in a very collaborative way.